So for me, this book is a way to showcase what Baylor has done with quality and how that affects physicians and the way they work, and how that affects patients and their outcomes. And it's an important journey that we've been through, starting a long time ago. My involvement was back in 1994 when we first formed HealthTexas. Now, HealthTexas is the employed physician group of Baylor Health Care System. We started with 50 or 60 physicians. We now have 600 physicians. And the important thing is, over these 19 years, we developed a very strong culture. The culture is based on several things. One, a strong emphasis on quality in everything that we do, taking care of patients, in immunizations, in preventive services, in disease management. We're strong in patient safety, doing the right thing, the safest thing. We have a strong committee about that. And then in what we call the patient experience, patient satisfaction, doing things for the patient that makes them more pleased so they're more likely to do what we ask them to do. Actually, the science has shown that patients who like their physicians have better outcomes. They're more likely to take the medicine, to follow up, to go see the next doctor, come back for appointments. So all these things, I think, give a better patient outcome. And now we're into patient efficiency. How can we best get patients taken care of in the most efficient way? If there are two ways to do things with similar outcomes, do it the less expensive way. So we're big into that now with a strong emphasis on that. Now, all this started in HealthTexas and since spread throughout the system. It became involved through the STEEEP initiatives later. STEEEP came along and we quickly jumped on that idea. This came, of course, from the Institute of Medicine. The STEEEP acronym stands for safe, timely, effective, efficient, equitable, and patient-centered. And we have then relooked at all of our initiatives in HealthTexas and also with other physicians outside of HealthTexas to direct in that fashion, because when you do it in that fashion, when you meet those STEEEP ideals, it's the best way to take care of patients. We believe that. And so this book is a lot about what that means to the physicians, to the nurses, to all the healthcare workers, and then most importantly, to the patients. What does STEEEP mean in the delivery of healthcare? When we first started encouraging physicians to do things in a quality way, the first pushback we got was that we already do quality medicine. Every physician thinks they do quality measures. Well, in their minds they were, but until you really measure something, you don't really know. So to me, quality is about doing things in a way you can measure and show the outcome. When you measure things, you can find sometimes ways to do things better. So it took a while to get that. In fact, physicians are highly trained, and they're trained to do things right and always in the best way, but sometimes that doesn't allow them to compare and to work collaboratively with other people or to work in a teamwork fashion. And that is not true anymore in HealthTexas. And we're putting that also into the accountable care organization we call Baylor to Quality Alliance, where we are all about not only trying to do quality, but then comparing and studying and testing. Is that the best quality? Is there a better way to do things? When there's variation, study variation. That means there's an opportunity to find ways to do it with less variability in a more tried and true way, a simpler way with better outcomes. So our physicians in HealthTexas are very attuned to change. When we can show that change is a better way to do things, then they're ready to change. You have to prove it first. And we have a strong committee structure. In fact, we have 26 committees in HealthTexas that look at different ways to improve the practice of medicine. And each of those works diligently to find a way to make things better, always. I've been asked sometimes, well, when does it end? When do we get to perfection? Of course, the answer is you never do. Things keep improving, and will always keep improving. So we need to always look and challenge ourselves. The way we did it last year may change in the next year, when we can show through metrics, through measurement, that it's a better way to do things. And that's in the culture of HealthTexas, and that's what we write about in the book. All healthcare workers, all nurses, all physicians always want to do their very best for patients. But unless you have a system that shows them how to get to the very, very best, which involves collaboration and studying what you're doing and working in teams, you won't get there. And I would encourage groups that want to try this, to get started with this, pick a project and show your physician you can do it better. Maybe it's the management of anticoagulation. Maybe it's a better system to get immunizations done. a better way to follow your surgical outcomes. Anything you want to measure and look at, if you do that, you'll find ways to improve. And so it's getting into the process. The process is what allows physicians to improve. You don't just do something the way you did it 20 years ago in medical school. You look to see if you can do it more efficiently, better. What's the new science shows? Is the new science correct? Let's challenge that with the old science. So it's studying actions. We call this a PDSA cycle. You look at things very rapidly. You get an idea, you study it, you analyze it, and then you change it. And you study it, analyze it, and change it. And this type of process allows constant improvement. It's not this huge change, it's small areas of improvement. And cumulatively, that's where you get the biggest gains, is by constantly studying what you're doing and finding ways to do things better. Healthcare in this country is going through a radical transformation. We're going to see a lot of change hopefully for the better, a lot of reasons for this change to happen. So we're all looking for ways to find how shall we change, and I think all of us are looking to books, to lectures, to leadership, to conferences. This book is one that also gives a guideline for that, because we've gone through this process and we are in a continual improvement process, but what we have learned through the years together, I think can be a template for others who want to try to study ways for them to get better also as medicine transforms in this country.